Hi, my name is Albesa. I'm going to be your nurse today. I'm going to go ahead and close these curtains to provide me more privacy and wash my hands. Now, can you please tell me your name and date of birth?
Agnes Amante, August 27, 1968.
All right, and what is your chief reason for visiting today?
Uh, it's a pain in my right ear,
Mhm.
and I've been exhausted for 3 days.
Okay, now if you describe this pain, would you say it's sharp, burning, dull?
Sharp.
When did the pain start?
3 days ago.
And you said the location was the right ear, correct?
Yes.
Okay, now would you say this pain comes and goes? Like it's intermittent or is it constant?
Comes and goes.
Okay, on a scale from 1 to 10, 1 being not that bad, 10 being the worst, how would you rate this pain?
4.
What would you say makes the pain feel better or worse?
When I use Q-tips to clean my ears.
Does it make it worse if you do that?
Yes.
All right, and you mentioned using Q-tips to clean your ears. Do you think that could be associated with the pain?
Yes.
All right, I have a couple more questions. Are you currently experiencing a headache or dizziness with the pain?
Dizziness, but no headache.
Have you had any surgeries related to head injuries in the past?
No.
Have you noticed any vision changes?
No.
Do you wear glasses or contacts?
I wear glasses.
When was your last eye exam?
6 days ago.
Have you had any hearing changes associated to the right ear, maybe difficulty hearing or anything?
Yes.
Okay, so difficulty hearing?
Yes.
And you mentioned using Q-tips. Do you still use them now and how often?
I still use it every day.
Okay, are you wearing any hearing aids?
No.
When was your last hearing test?
2 years ago.
Okay, do you have a personal history of diabetes at all?
Yes.
What type? Type 1 diabetes, type 2?
Type 2 diabetes mellitus.
Okay. Do you regularly exercise? If so, what's your routine?
No, I don't.
Okay. Do you have a family history of diabetes?
Yes, my dad and my grandfather.
On what side, maternal or paternal?
Maternal.
All right. So, with that done, I'm going to go ahead and take your vital signs. And I have a couple more questions now. Could you please tell me the date?
November 21st, 2020.
And do you know where we are right now?
Nephrology clinic.
All right, you already told me your reason for coming here. So patient is alert and oriented times 4. Volume and tempo of speech is appropriate to the situation and clear. Mood and affect is positive and appropriate for situation. I'm going to go ahead and start your head to toe assessment first. So just relax. Now I'm going to assess the eyes. The pupils are equal and around 3 millimeters in diameter bilaterally. They are round bilaterally. Now I'm going to test the reactive light. Just look straight forward. Okay. Straight forward. Okay. So pupils are reactive to light bilaterally. Please follow the pen light. Okay. So accommodation performed. Perla noted. Now, next thing I'm going to do is, if you could please look at the tip of the pen light and try to follow it with your eyes without moving your head. And go, 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 here, here, here. Okay, EOMs are intact. If you could please remove your mask for a second. Now I just need you to smile and puff out your cheeks and raise your eyebrows, please. So facial symmetry noted. Please say and open your mouth. All right, so mucous membranes are pink, intact, moist, with no edema or lesions. Noted. Okay, you can put your mask on now. Now with that finished, I'm going to go ahead and assess your skin. You can just pull your sleeves up. Okay, I will be assessing the skin for color, moisture, temperature, and edema. First, starting with the upper extremities. So, skin color is appropriate for race. Skin is dry. warm to the touch, and edema. No edema or pitting edema noted. So skin is appropriate for raised, dry, warm to the touch, no edema or pitting edema noted bilaterally on the upper extremities. Now I'm going to be testing your lower extremities, so please just lay your hands here. Skin color is appropriate for raised. Now testing for moisture. Skin is dry. Temperature. Warm to the touch and edema. All right, no edema or pitting edema noted. Skin color is appropriate for raised, dry, warm to the touch, no edema. Lesions or pitting edema noted bilaterally on the lower extremities. Varicose veins were seen bilaterally on the lower extremities. Next thing I'm going to do is assess all the nail beds for color and capillary refill. Okay, just raise your feet. So nail beds are pink, intact, without lesions or edema, and capillary refill was less than 2 seconds bilaterally on the upper and lower extremities. All right, so next thing I'm going to do is assess your carotid arteries, first by palpating. All right, and then I'm going to take a listen. If you could just raise your head up a little. Okay. All right. So carotid pulses are +3 bilaterally with no bruits noted. Next thing I'm going to assess is the cardiac auscultation site. So first I'm going to find the sternum and find the rib. Okay. First intercostal. Right here. So the first site I will be listening to is the aortic site, which is located on the second intercostal space on the right sternal border. So S2 is heard better than S1 on this side with no heart murmurs noted. Now I'm going to move along over here onto the pulmonic site, which is located on the second intercostal space on the left sternal border. Here I am hearing S2 better than S1 once again, with no heart murmurs noted. And then straight down would be Erb's Point, which is located on the third intercostal space on the left sternal border. Here I'm hearing S1 equally to S2, with no heart murmurs noted. Finally, I'm going to move down to the tricuspid site, which is located in the fourth intercostal space on the left sternal border. And I am hearing S1 better than S2 with no heart murmurs noted. If you could please lift your breast up so that I could assess the mitral site over here, which is on the fifth intercostal space on the left sternal border, and it aligns with the clavicular line. Here I'm hearing S1 better than S2 with no heart murmurs noted. I'm going to go ahead and take the apical pulse for 1 full minute, starting now. All right. 74 beats per minute noted on the apical pulse. Now if you could just ball this hand up into a fist and hold it right here and just relax. All right. Respiratory rate is found to be 20 breaths per minute, regular rhythm, unlabored, and even. Next thing I'm going to do is listen to the lung sounds anteriorly. So what I'm going to have you do is whenever I tell you to breathe, just breathe, please. Okay. Breathe. 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 And then please lift your breast up again. Breathe. And breathe. All right, so lung sounds are clear with no adventitious sounds noted anteriorly. If you could just stand up, please, and then turn around. And I'm just going to move this over. And once again, if I say to breathe, just breathe. 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 And breathe. Okay, lung sounds are clear without adventitious sounds noted posteriorly. Now, if you could just raise your arms up, please. I'm now going to listen to the lung sounds laterally. So breathe. Breathe. All right. Lung sounds are clear with no adventitious sounds noted laterally. All right, thank you. And now you can go ahead and please lie down on your back and expose your stomach. We'll be doing the abdominal assessment now. Okay, first thing I'm going to do is inspect. Belly is round, striae noted, no edema or lesions, and no other abnormalities noted. I'm going to go ahead and take a listen, starting first on the right lower quadrant. If you could move your hands, please. Right upper quadrant. Left upper quadrant. And the left lower quadrant. All right, so normal active vowel sounds noted on all 4 abdominal quadrants. I'm going to go ahead and palpate now. Please tell me if you have any pain or tenderness while I palpate. All right, no pain or tenderness noted after palpation of the abdomen. You can go ahead and put your clothes back on. I'm going to go ahead and assess the radial pulse on the left side. All right, radial pulse on the right side. Radial pulses are 2+ bilaterally. Now I'm going to assess the posterior tibial pulse on the left. Now on the right. Posterior tibial pulses are 1+ bilaterally. Now the dorsalis pedis on the left first. And now on the right. Dorsalis pedis pulses are 1+ bilaterally. Now you can go ahead and sit up. I'll help you up. Okay. Now just follow my direction, please. First thing I want you to do is raise your hands up like this. Put them down. To the side. Put them down. Arms out. Flip. Flex. Extend. Flip. And rotate. Okay. Now keeping your hands like this, please. Push up against my hand. All right. Push down. Okay. Now I want you to lift your hand like that. You can close your hands. Flex. Go ahead and just fold your hands this way. Against. Okay. Now push. Now hands together like this. Push forward. Okay. So full range of motion and strength. 5 out of 5 bilaterally on the upper extremities. Next thing I want you to do is you can lie back down again. Raise both legs up, down, this leg to this side, back, this leg to that side, and back. Now I want you to bend both your knees, put them out again, and try to point your feet forward. Okay, now raise legs up, okay, down, this side, now back, okay, now this side, all right, back, and push forward with your feet. Okay, so full range of motion and strength, 5 out of 5, bilaterally on the lower extremities. Now, last thing I want you to do is please sit up again, and then we're gonna get up and just stand right here.
Okay.
Face that way, and just take 3 steps forward, 3 steps back, turn around. All right, so we have a steady balanced gait. Arms were swinging evenly and able to turn smoothly without any difficulty. All right, you can go ahead and take a seat. That's all I need from you. The doctor will be back here in a couple minutes. Just let me know if you need anything.
Thank you.